Hello everyone, I am Dr. Diron. We as a doctor prescribe medications to the patients, but do they really know the name, at least the name of the medication? Do they really know the mechanism of action in a simple way, how it works? Do they really know the side effect of the drugs? We as a doctor should educate every patient as it is our responsibilities. On that list, I'm going to talk about medications in common and its use and its side effects and how it works and all. As a knowledge, I would like to give it to the patients. On that, the first drug that comes in my mind is aspirin. So aspirin is one of the common drug wherever you go to hospital, you can see the patients are using, especially who are having some heart related problems, who have undergone a stent replacement or stent placement, or have undergone a valvular replacement and valvular surgeries and etc. So aspirin comes under non-steroidal anti-inflammatory drugs, but it has so many nicknames according to its function. It can be an anti-inflammatory drug, it can be a antiplatelet aggravator drugs, it can be even a painkiller, etc. According to its function, we can give so many names, but especially I'm going to talk about how aspirin, it prevents formation of clots, or how it makes your blood in fluid states, maintain a fluid states. Especially in our body, there are some kind of mechanism is going related to the platelet aggravation. First of all, we all know that from the membrane lipids, arachidonic acid is coming. So from arachidonic acid, the prostaglandin comes. How? The arachidonic acid is converted by COX-1 and COX-2 into prostaglandin, and that prostaglandin will provide some chemicals such as the prostacyclin and important thromboxane A2, and this thromboxane A2 is responsible for the platelet aggravation. That means it forms clots, it makes your blood thick. But what aspirin does is here it blocks the conversion of arachidonic acid to prostaglandin by inhibiting COX-1 and COX-2 that prevent the formation of thromboxane A2, that prevent the formation of clots, and it makes your blood more fluid, more thin. But the problem is, it does have some side effects. If you see the pathway of the conversion or production of thromboxane A2 prostacyclin, you see a prostaglandin, a chemical that is very important to your mucosal lining, especially in the stomach. It produces a lining that is a protective lining of stomach that prevent damage of the stomach inner layer from acid and other food substance and other medication, whatever it is. So when you take aspirin, it blocks the formation of prostaglandin. We all know that from arachidonic acid prostaglandin comes, it blocks that conversion by blocking COX-1 and COX-2. So here when you take aspirin, there won't be a prostaglandin or very amount of prostaglandin, and that is a bit danger to the stomach. That's why the people who take aspirin complain about burning sensation and gastric ulcer related problem. So when you see people who are taking aspirin, almost physician will prescribe an anti-ulcer drug, especially aspirin plus omeprazole. But the one problem is when you take aspirin with omeprazole, that reduces the function and capacity of aspirin when you take with omeprazole. So the one take-home message is, when you prescribe aspirin, you should prescribe lansoprazole in spite of omeprazole, because lansoprazole doesn't alter its mechanism of action, or it doesn't alter its function. Rather, omeprazole does. So whenever you prescribe aspirin, prescribe lansoprazole, and a very healthy dietary advice. That is very necessary. The diet is almost always is the first step of management of any diseases. Second, the medication. So hopefully, I hope this message will be useful. I will see you in a next video with another drug. Better health, better tomorrow. See you all. Bye.